Nancy says that her whole body hurt, specifically lower back and legs. The pain has led to disruptions in her daily life. She can't cook or bath. All she does is lay in bed all day long. She has very high level of worry about her illness. She appraises her bodily symptoms as threatening, harmful, and troublesome, and often thinks the worst of her health. She slipped from stairs. Medical examination done and she had no injuries. She seems very weak, so got admitted in hospital for 24 hours. She believes the incident seriously hurt her and she started complaining of headache. She consulted multiple doctors for similar symptoms and she was unresponsive to all other medical interventions. It increases her worry as she feels that nobody seemed to understand her. Most of the somatic symptom that she experienced has been persistent soon after her husband died, which is several years ago. She was referred to a psychologist. After the evaluation, it is found that she has severe somatic symptom disorder that need to be treated. Most mental health disorders are characterized by mental symptoms. That is, people have unusual or disturbing thoughts, moods, and behaviors. However, in somatic symptom disorder, mental factors are expressed as physical symptoms, a process called somatization. And the person's main concern is with physical symptoms such as pain, weakness, fatigue, nausea, or other bodily sensations. Females are more likely to be diagnosed with somatic symptom disorder. Symptoms. Symptoms range in severity and people with this condition usually experience a range of symptoms. However, some of the most common symptoms of the disorder include physical symptoms. Pain. The areas where the pain is being felt vary from person to person. There will be fatigue, weakness, shortness of breath, etc. Neurological problems. Weakness or paralysis, abnormal movements, loss of sensation or numbness, seizures, etc. can be seen. Gastrointestinal complaints. Abdominal pain, digestive problem such as diarrhea or constipation. Sexual symptoms. This include painful sex. Psychological symptoms. Person become dependent on others, demanding help and emotional support, and becoming angry when they feel their needs are not being met. They may also threaten or attempt suicide, often dissatisfied with their medical care. Related disorders. Illness anxiety disorder. It is characterized by concern over having or acquiring a serious illness and not the actual presence of somatic symptoms. Individuals spend a great deal of time analyzing their body for clues of potential ailments. Earlier, it is used to known as hypochondria. It is a condition that causes a person to think that they are always at risk of getting sick. Unlike somatic symptom disorder, a person with hypochondria will typically experience no physical symptoms. Next is conversion disorder. It is characterized by one or more symptoms of voluntary motor or sensory function which are either functional or psychogenic. For example, a person with the disorder might suddenly be temporarily paralyzed. Next is factitious disorder. It is characterized by deliberate falsification of medical or psychological symptoms of oneself or another with the overall intention of deception. This condition causes a person to fake an illness or symptoms of a condition that they don't have. Causes. Psychodynamic causes of somatic disorder include primary and secondary gain. The primary gain provides protection from the anxiety or emotional symptoms. This need for protection is expressed via a physical symptom such as pain or headache. The secondary gain can range from attention and sympathy, obtaining financial assistance, etc. Cognitive causes of somatic disorder include negative beliefs or exaggerated fears of psychological sensation. For example, an individual with a headache may catastrophize the symptoms and believe that their headache is the direct result of a brain tumor, as opposed to stress or other inoculate reasons. When their medical provider does not confirm this diagnosis, the individual may then catastrophize even further, believing that they have an extremely rare disorder that requires an evaluation from a specialist. Behavioral causes. Behavioral causes of somatic disorder include reinforcers such as attention gained from others or receiving disability. Socio-cultural causes. Socio-cultural causes include familial influence and culture. Diagnosis. Physical examination. It is to determine whether symptoms are due to a physical disorder. Doctors do a thorough examination and often do tests. Doctors need to perform many tests to rule out other possible causes before diagnosing the SSD. Psychological evaluation. In case of no evidence of a medical condition, person might be referred to a mental health professional to help make a diagnosis of somatic symptom disorder. Use of DSM-5 criteria. It provides diagnostic criteria for identifying somatic symptoms disorder. Somatic symptom disorder can be distinguished from similar mental health disorder by its many persistent symptoms and the accompanying excessive thought and worries about the symptoms. Management. Biopsychosocial model of treatment. It is one of the most effective treatment for somatic disorder as it takes into account the various biological, psychological and social factors that influence the illness and presenting symptoms and includes a multidisciplinary approach. Psychotherapy. Psychotherapy options include interpersonal psychotherapy, CBT, that is cognitive behavioral therapy, and behavioral therapy. Cognitive behavioral therapy has shown to be the most effective form of treatment used in treating SSD. During therapy, the therapist will help to understand why you feel the way you do about your symptoms and teach the person the ways to cope with the anxiety that results from it. Psychopharmacological interventions or medications. Medications are rarely used for somatic disorder due to the side effects of the medication. It produces more harm than good. When used, they deal with comorbid disorders such as depression or anxiety. Coping up with SSD. Meditation. Practice meditation or mindfulness. It is effective in the reduction of persistent and worry-related thoughts and pain symptoms and chronic pain. Balance negative thoughts. For example, if you feel pain in your joints and you are afraid that something may be wrong, focus on the fact that you can still do something despite the joint pain and that you are stronger than the pain. Distract yourself. An easy technique to focus less on these persistent and disproportionate thoughts is to keep yourself busy. Make sure you have something challenging to do. Hope you like this video about somatic symptom disorder. Please subscribe the channel for more videos on related topic. Thank you and keep smiling.